Nutrition Advisor, while Dr. Osita Okonkwo is a Country Director, Nutrition International, and they are both here with us in the studio to speak on the benefits or otherwise of breastfeeding. Well, hopefully there's no otherwise. Well, thank you for joining us this morning.
Thank you
for having me. It's really exciting to be here.
Well, yes, thank you. Well, let's start with you, Madam Pauline. We often focus so much on, the baby after birth, neglecting, the mothers, which is great. Focusing on the baby is great, but also the mothers, their mental health and all of that, their nutrition is often maybe neglected. And I believe this also affects, what comes through the breast milk from the mothers. How do you encourage, the focus on both the mother and the infant to ensure that the mother is not neglected and, the quality of the breast milk as well is not affected?
Yeah, thank you so much. And yes, you're correct. Over time, we have mostly, focused on the child. World Breastfeeding Week, we're actually looking at breastfeeding and who is being breastfed, the child. But we celebrate the mothers. We encourage that so much now in most of our campaigns. We're no longer focusing only on the infants, but the health of the mother is crucial. Her mental health is crucial. I think 2 years ago, we did have some review of maternal mental health guidelines nationally. So I think that is something that we need to speak more about so that people know that the mother is not neglected. Her health is very important. And to focus on her, like you did mention, this is why the theme always carries create a sustainable support system. These are all in support and to help the mother to be able to breastfeed, from feeding, her health, mentally and otherwise. What do we promote for that? It starts from the home. Her partner needs to give her utmost support. We start from saying use kind words, use reassuring words, mental health, right? So breast milk production is also highly tied to the psychology, her mental health. That is what transmits information to the prolactin, which is in charge of breast milk production. And that is why sometimes you have mothers tell you, I can't produce breast milk. I mean, it's not flowing. I can't. Most of the time, when you take some time to, help her relax, we tell the husband, just put a towel in hot water, massage her back, make her feel good. And you see, the things would change because, her body has gone through shock during labor, and she's in pain and all of that and recovering. So that's from the family angle. We have from the workplace. We do not want our mothers to have to choose between the workplace and feeding their children. So we encourage and we're advocating for workplaces to have breastfeeding spaces. It could be crèche if you're able to afford it, or it could be just a corner. Sometimes we tell people, just like you go to the hospital and you have to take injection and they pull that blue curtain around, like as minimal as possible, just have a corner to enable them do this. Support them with their works, give them lower working hours, and all of that.
Okay, quite interesting. I think all our mothers should take their flowers. Now, Dr. Okonkwo, let's look at it this way. Because of our peculiar challenge in this part of the world, the poverty level and the environmental issues, and most of our women go through a lot of pains, tears when they're nurturing these children, that some even struggle between how do I even maintain my mental balance, like you said, my survival and the children. And there was this 3 P's they talked about: practice, patience, and persistence. Now, how do you speak to mothers who may be going through some challenge and to kind of ensure that, look, their children get it, not because they don't want to, but because what they're going through is so challenging, some kind of just find other means because they must survive. So how do we speak to that issue?
Yeah, I think what is more important here is what she alluded to, the fact that breastfeeding is an emotional process. The woman has gone through pains, through childbirth, and now she has to breastfeed her child. If she understands the benefit for herself and for the baby, that will be the motivation. Now, let me take you down through what could happen. When a woman delivers, she goes through the pain, we know. But of course, she also wants to get back to herself. There are some element of weight gain, during pregnancy. Breastfeeding helps the woman to return back to herself. Right. It also helps to, delay menstruation, so she doesn't have to go through another cycle of pregnancy immediately after delivery. It also helps her to attach and bond with her baby. So this is what gives her the motivation to, want to continue. Breastfeeding emotionally, creates an semblance, a semblance of emotional balance for the woman, and it helps her feel, the confidence of being a mother, And then you look at all those, and you look at also the long-term effects of breastfeeding, the fact that it's helped to prevent some element of cancers in the woman, ovarian cancers, endometrial cancers, and all that. So when she understands the benefit for herself, the benefit for her baby, and the fact that even the release of oxytocin, helps to allow some element of contractions in the uterus that gets her back to her normal self. She's quite motivated. And I think that's what we need to push. Let the woman understand that breastfeeding is not only good for her baby, not only prevent the child from having intercurrent illnesses, diarrhea, and all that can happen. Not only that it helps the child to grow well emotionally, help the child grow well in cognitive development, it also is beneficial to her.
All right. And I'd like you to hold that thought because we need to take a quick commercial break. Let's pay our dues. We'll be right back. Stay with us. We're glad to have you watching FCT Brief, and we're still discussing maternal infant nutrition in relation to the World Breastfeeding Week. Now, Mr. Okonkwo, in our healthcare system, support for breastfeeding is still very limited. You walk into some hospitals and there is no lactation counseling, no help for the mothers to teach them how to, breastfeed and handle, this psychological trauma that comes with, childbearing, and there's no friendly follow-up care. Why do we still treat breastfeeding as something that, the women should just know about?
I think that is changing. A lot of effort has been made at the moment to encourage and train healthcare providers through our medicine training, which has gone around the whole country, and we are stepping it down to the health facilities. We've really understood the need for health facility workers to encourage mothers to breastfeed. And I think that is, but of course, we can do so much. You can train health workers, provide adequate counseling and support to the woman in the health facility. What about at home? So most of the bulk of the time, the woman is with her baby at home or at the place of work. And that's why we're taking the message back to the community and to the place of work, that they should provide breastfeeding-friendly, environment for the woman at the place of work. 2 years ago, that was a campaign, making a workspace breastfeeding-friendly. Now we're also asking at home, that the relatives, the husband, should support her, make breastfeeding a very enjoyable, process for the woman and for the baby. So I think it's not only for the health workers. Health workers can only advise, support them during the contact times they have with them. But the bulk is when she gets home, what happens at home? What happens at the place of work? And we need the husband to support the wife. We need the community to support the relatives. Everyone involved should be able to know that there is a benefit for that 6 months exclusively for the child to be breastfed. These days, the economic pressures, like he mentioned earlier, is what is pushing people to, reduce the time, they have for the children. I spoke to some parents the other time, and I realized that after 3-4 months, they put the child in a crèche, and the woman has gone back to work. So right now, we are advocating for a bill to push government to, legalize 6 months exclusive breastfeeding together with maternity leave for the woman. So the woman has a chance to go home, spend time with her baby, and breastfeed. So the contact time of the mother and the child should be encouraged during, the maternal leave.
I also like to follow up with something very critical, which is antenatal. During the antenatal is when, these nurses teach the women on what is expected and what should be done. Shouldn't we also create a system where the men are also, put in line to what should be expected of them when their wives give birth?
Yes, we are encouraging the male participation during the ANC for the woman. And of course, this is a process. But at the same time, we're also encouraging the woman to come early. A lot of times, the concerns we have is that the women don't come to register for antenatal early in their pregnancy. Don't forget, it's not only the counseling that is provided. We also have a chance to give the woman multiple micronutrients that will help her and her baby to grow well during pregnancy. And that is the key. If the woman comes early during pregnancy, she has a chance to receive full complements of the micronutrient supplementation that she should have, which will help her throughout the pregnancy and also improve the outcome of the pregnancy. And then through that period, if the contact time is enough, up to 8 times of visits at the ANC, then she has enough time to practice and plan for delivery. But most of the times, they come to her facility when they are about to deliver. 2-3 months to delivery. And that's not enough time for her to receive the complement of MMS that the government is providing free of charge. Okay. And that is more important.
You want to add something?
Yeah.
All right.
I'd like to add something to that. So that's very apt. We're encouraging men to participate. We've had very few cases that I learned of that the husband said he went with the wife to the hospital during antenatal and he got to learn all of this. Interestingly, implementing partners too, mostly in the Northeast anyway, rural communities, did establish what we call father-to-father support group. Father-to-father maternal, infant, and young child nutrition support groups within the communities, because we realized that, educating the women alone on how to prepare themselves, take care of themselves during pregnancy, give birth, and take care of the young child, sometimes it met opposition at home because the father is the decision maker. I say, no, you're not doing this. I don't even want my wife to breastfeed for this long, But being in that father-to-father support group has helped a lot of families to be able to, be on the same page to improve nutrition and breastfeeding.
Okay, there was a time that the crutches at workplaces were it was the in thing, and we kind of dropped from it. I know those days you go into ministries and you find crutches there, but we don't seem to have it. Now it's talking about a bill. Now, how should we ensure that we don't get back to where we were, where we had the crutches, and ensure that, look, even a bill is passed, we're going to follow this bill? Because like I watched on social media just a few days ago, where a woman that said just gave birth about 4 days ago was beaten by her husband. Wow. Now, instead of talking of sanction for the man, for instance, probably is very ignorant of certain things. I'd like you to speak to those issues. You just talked about what you're doing for the men to carry them along, and also for the women. Okay.
So in relation to the crutches and passing this bill, I think the government has already started working on that. 2 years ago during the workspace, it was announced, though we can't lay our hands on the document, but it was announced that the 6-month maternity leave, paid leave should be passed. And some states like Kwara and others, a few more, have keyed into this. And mostly when we have meetings with the ministry, I remember I've asked some of them, and they do now have crutches that are functional. We're continuing to promote this. And because of the excuse of, we don't have such a large space, we have trickled it down to say, even just a corner, it doesn't have a full space. So we hope that will help. Speaking about the policy also, we are also advocating for the government to enact it. It's one thing to pass it, it's another thing to enforce and make sure that it is carried on. So that will also really help. And basically, when we have that running, not only in the public sector, we're also encouraging that for the private sector. And one of the meetings the nutrition department held was on planning, is to meet with the cooperative lead organization, I think, of private partners and organizations like the banks and all of that, to encourage this even across the nation.
When conflict or disaster strikes, like displacement, floods, or insecurity, breastfeeding often suffers too. There's no clean water, the healthcare system is poor, no safety, all of which makes breastfeeding a baby extremely hard. How do we build emergency response plans that truly include the needs of both the infant and the nursing mothers?
Okay, thank you so much for that question. So I was privileged, I call it an honor, to have worked in Maiduguri and Yobe in an emergency response for nutrition for over 4 years. And so we really met with this kind of displaced people and had to deal with them. So generally, the beautiful part here is that breast milk is natural. It's a gift from God. Every woman has the capacity to breastfeed in almost any situation. But like you said, we talk about the mental health state and health of these women. When they are displaced, their mental state is distorted. So as an emergency response, we prioritize pregnant and lactating
I'll
women.
let you to hold that thought. Okay. We'll still continue, but that'll be right after this short break. Don't go anywhere. There's still more. Stay with us.
In the beating heart of Owerri, business never sleeps. From sunrise to sundown, the wheels keep turning. And behind the scenes, vision meets action. Governor Hope Uzodimma's leadership has turned manifestos into reality, transformations that feels like a miracle. But progress needs peace, and in Imo, it's not left to chance. From land to sky to river deep, Guardians are watching, protecting dreams and opportunity. At Orashi's quiet shore, hydropower is rising, set to energize a growing economy. The change is visible. New roads emerge, industry hums, communities come alive. At the center, a digital revolution. 500,000 young minds trained each year to build the future. As Orashi rises, so does Imo and the hopes of a hard-working people. A new Imo is on the rise.
I know if you forget Nigeria promised to me.
I am reliable. Oh, I know I'm responsible for my actions. I am strong, healthy. Can't you see I am blessed? I'm a real Nigerian, born Nigerian, a resilient Nigerian. I live by the citizens' code. I'm a real Nigerian, accountable Nigerian, a caring Nigerian. I live by the citizens' code. I'm a real Nigerian, born Nigerian, a resilient Nigerian. I live by the citizens' code. I'm a real Nigerian, accountable Nigerian, a caring Nigerian. I live by the citizens' code.
Brought to you by the National Orientation Agency, NOA.
Still FCT brief, and we're still discussing maternal and infant nutrition. You were speaking about, response mechanisms in place for women that are displaced or facing issues of insecurity. So I'd like you to complete your thoughts on that.
Yes. So I was saying we prioritize women, pregnant and lactating women, and children under 5. And the emergency response is usually a comprehensive one. We have shelter. We have organizations that will take care of shelter. We have organizations that will provide psychosocial support to all IDPs, especially the pregnant women and children. And one of the mediums to do this is these support groups. So when these women gather together, mostly a group of 15, around just their neighborhood or within the camps, they're able to, do activities that, brighten up their moods, singing, creating songs. And within that, in that meeting, the community volunteer passes these messages to encourage them. Not only that, the community volunteers will also do follow-up visits to their homes at least once every week to check on them, ask questions, what are their challenges, and continue counseling. And then once during the week, they also get to reach out to the facility, especially where they're pregnant, and this also can be done. Yeah,
Okay.
so both at home and at the facility.
All right, Dr. Okonkwo, she just talked about the support system. I guess most of this is done by the private sector. What exactly can government, what a support system government can create for these mothers? Because I also know that we talked about the entry level to university. Nobody is talking about the entry level into primary or nursery school, and that is why a lot of women, just because of economic reasons, just take their children to those schools. And once they take them to those schools, the aspect of breastfeeding, it's out, because some children go to nursery school as early as even before 1 year. So what kind of support system can government create for these mothers?
Yeah, earlier on I mentioned something about the bill and making it mandatory that both private and public institutions recognize the need for a woman to have appropriate time with the child during maternity. And we said 6-month maternity leave should be made compulsory in Nigeria. Some states, like we have mentioned, Jigawa just announced recently 6-month maternity leave in their states. So when a woman delivers and has 6-month maternity leave, which is paid, gives her the time for her to be with her child for that 6 months. Exclusively, she will breastfeed. When she returns to work, she has a place in the place of work, we may call it a crèche, where she can place the baby and have access to the baby. Breastfeeding not only for 6 months, we said exclusively without addition of any other substance for 6 months. But you can breastfeed for up to 2 years. Okay. So that time, the government, and private institutions should provide a crèche, an environment where the woman and the baby could have the contacts, so she can continue to breastfeed. Now, it has been shown that children who are well breastfed have better cognitive functions. They are not prone to, stunting like we've seen. So the chance of the child's survival is huge and higher. And that is when the child will mature well enough to be able to enroll into school at appropriate times. So these are policies the government need to institute. And that is why we think at Admission International, we are pushing for government to come involved. And that's also the reason why we're also working with the National Assembly to look at it and make it a national process for a woman to have a child, as I said, to her child. And everything we have mentioned about coming to the ANC early enough, the father being motivated to support the woman, during pregnancy and during breastfeeding, should be part of what we should include in that bill. Now, I'm talking about the male factor, which is very huge.
Well, you can just complete your thoughts.
Yeah, the male factor is very huge, and that is very, very important to encourage. If the man supports his wife to breastfeed, I am assure you that the woman will breastfeed.
And final words from you in 5 seconds. We just have 5 seconds.
Breastfeeding is a gift from God, but it is our collective responsibility. So together, let us join hands and create sustainable support systems for breastfeeding.
Well, it's a fine place to leave it. We must say thank you so much, Mr. Osita, Okonkwo, and Pauline Adah. It's a pleasure speaking with you this morning, and we definitely hope we have you back here again to contribute on matters like this. Thank you so much.
Thank you.
That's our offering today. We are glad you could be a part of it. We'll now hand you over to Lagos, where Veronica and the rest of the team are standing by to continue with the rest of the show.
Thank you to Jesu and Esha Momo for that timely conversation.